Good morning, myself Dr. Mrunal Akre, Assistant Professor, Department of Dravyagun, Global Institute of Ayurveda. In our pharmacological series now we are going to see antifungal drugs. In our last lecture we have seen about antimicrobial drugs. Similarly to antimicrobial drugs and their action, antifungal drugs have the similar kind of action. In antifungal drugs they are used in superficial and deep, rather we can say as systemic fungal infections. Their classification are antibiotics, anti-metabolite flucytosine, azoles, allylamine, tribinafene and other topical agents. In azoles, two groups are there, imidazole and triazoles. Amidazoles have two categories, topical groups and systemic group. In topical group, we can use clotrimazole, iconazole, miconazole and oxyconazole. In systemic, we use ketoconazole. Triazoles are used systemically only. They are fluconazole, itraconazole, voriconazole and posaconazole. Then in miscellaneous topical agents, we use tolnaftate, andecyclinic acid, benzoic acid, quinidochlor, cyclopyrox, butanamethine and sodium thiosulfate. Pauline antibiotics are the pauline is derived from highly double bonded structure. Amphotericin B is described as prototype. Amphotericin B means AMB. It is obtained from Pteroptomys nodus. Its mechanism of action is the paulines possess a microcyclic ring on one side and several conjugation double bond and has hypolipophilic action, which on the other side the hypophilic may be due to OH group. It is administered in the dose of 50 to 100 mg QID for intestinal monolysis and topically for vaginitis and otomycosis. Then nystatin. Nystatin, it is obtained from Streptomyces noriscus. It is similar to amphotericin in antifungal action. It has higher systemic toxicity and it is used in locally for superficial candidiasis. Then in candidiasis, oral, vaginal or cutaneous, we can use first drug of choice is fluconazole. These are the drugs. And second choice is itraconazole, fluconazole. In these are the diseases and the drug of choice for how we can use antifungal drugs. Cryptococcosis, a first drug of choice is amphotericin, and second drug we can use fluconazole. Histoplasmosis, in first drug of choice is itraconazole and AMB. Second is fluconazole. Coccidioidomyosis, first drug of choice is fluconazole or AMB and second drug of choice is itraconazole or ketoconazole. Blastomycosis, first drug of choice is itraconazole or AMB and second drug of choice is ketoconazole or fluconazole. Then sporotrichosis, first drug of choice is AMB and second drug of choice is itraconazole. In paracoccidioidomyosis, first drug of choice is itraconazole and second is AMB. Aspergillosis, first drug of choice is Vorimba or AMB and second drug of choice is itraconazole or POSA. Mucormycosis, the first drug of choice is amphotericin and second drug of choice is posaconazole. Choromomycosis, first drug of choice is itraconazole and second drug of choice is posaconazole or terbinafine. These all drugs we can use in the treatment of fungal disorders. So this was all about antifungal drugs. Thank you.